Good morning. Welcome to our video. I'm Heidi Arens, a nurse practitioner at the Center for New Medicine. I'm joined here by my wonderful colleague Liliana. She's a nutritionist here at the Center for New Medicine. And today we're talking about integrative therapies for eczema and psoriasis. And those are two conditions that are autoimmune in nature. And autoimmune means that there's a wide variety of autoimmune conditions out there. These two relate to the immune system being hyper or upregulated. So the immune system has become so overactive that it's now attacking your own body tissue. And in these conditions, it's attacking areas of the skin. And they manifest in different ways. They present differently and they look differently, although they can have similar features. But these two conditions are very, very common. And we see them in children, we see them in young adults, we see them in the elderly, we see them, all across the lifespan. And a lot of people are very, very burdened by these conditions, and they've suffered with them for a long time. So today we're going to take some time to talk a little bit about these conditions, treatment options, testing options, and alternatives that you can do for these two conditions. The biggest thing with any autoimmune condition is that we want to find out the root cause. So by and large, most autoimmune conditions are starting from an immune system that is no longer able to tolerate the load put on it. And so it's overacting. And a lot of times that can be due to infections. It can be due to toxins. It can be due to chemicals. It can be due to stress that the body can no longer handle, and it's manifesting as an immune system that gets upregulated. So there's a lot of inflammation. The problem with this is that it's so severe that it's now attacking your skin, and you develop these very sore, painful cracks in the skin. You can get skin infections. They can bleed, they swell, they're painful. Oftentimes people want to cover them. They don't want to look at them. They don't want to expose them. And so from that standpoint, emotionally, it can be very challenging. They're often treated with steroids to calm that inflammation down. That could be topical steroids or oral steroids, something like prednisone. It could be treated with IV steroids or even a biologic medication or an immune suppressant. And so sometimes that's the course of action that a lot of conventional treatment options are giving you, because that's the traditional or conventional way of treating these illnesses. The problem is that it's not getting to the root or underlying cause of why your immune system is so angry and upregulated. And so there may be genetic components, there may be environmental components, there may be diet and lifestyle components, there may be an intestinal permeability issue or a leaky gut, which maybe happened over the course of time. And that created a foundation for the immune system to start attacking all these things coming at it just from the gut barrier being broken. And so we want to get to the root of that. There's a lot of testing options that we do, not only looking at the skin itself, but we want to look at, are there inflammatory markers that are rising? Are there autoimmune markers that we can measure by blood work? Are there infections that we can detect? Viral infections, parasitic infections, bacterial infections. So those are things that we can start to uncover with stool testing, with energetic testing, with all kinds of different various testing options. What I want to talk to you a little bit about is the other components that we also look at that maybe aren't being addressed, which are emotional components, as well as food is playing such a huge role in any autoimmune condition. And so, Liliana, can you tell us a few things that you discover and you work with people on in terms of how they can start to look at their diet and look at their stress and look at their emotions, and what are we helping people from that standpoint?
So a lot of the patients that come in with any autoimmune disorder are coming because they have an overload of what we call stress in so many different varieties, whether it is the environmental stress that is the unseen, the food sensitivities in which they may not even know, but a lot of it is just emotional overload principle, the inability to be able to cope with today's hyperactive lifestyle. And I always ask them, when it does flare up, do they notice it's during high periods of their stress? And oftentimes they say, yeah, that really exasperates it. So I really try to get them to understand the foundation and that we don't work from the outside in, we work from the inside out, because obviously it's an outer thing, and the first thing people want to do is arrest the annoyance of the itching and the pain. So obviously we want to be able to give them something topically, naturally would be better rather than steroids, because the steroids in fact go straight into the bloodstream and will also lower your immunity, and then you're susceptible to all kinds of bacteria that can begin to form when we have lesions on and we scratch and then we get bacteria. Now you have a secondary infections. So we don't really like to do steroids unless it's absolutely necessary. And so there's different colloidal oatmeal type of creams that we can put on there, just to arrest the basic, I'm itchy, I'm uncomfortable, but we really need to look at the gut, as Heidi said, because when we have these barriers on our skin, and of course when the skin begins to lose its barrier, then all of a sudden now it's lost its moisture, and then it allows these infectious viruses or bacteria in. Same thing with the gut, and so we have this barrier to the gut. But oftentimes when we're under duress in our life, just even 24 hours will disrupt the biome in your gut. So, which means that you're going to start to decrease the friendly bacteria, and then it's an opportunistic environment for the unfriendly bacteria just to start proliferating. And so when we have this dysbiosis, just with a 24-hour period of stress, and then of course most people don't just have it 24 hours, they've got kind of a gnawing stress on a day-to-day basis that really starts to create a what we call a leaky gut situation, because when you're under stress, the digestive system really starts to shut down because it's trying to get energy to the hands and the feet for a stress modality. So the digestion is impaired, and then oftentimes we see constipation with that, sluggish bowels. And then, of course, the immune system or the lymphatic system starts upregulating that into its system, and so we get auto-intoxication. And when the gut becomes permeable and it starts to have little junctures of the space that should be really tight, allowing food that shouldn't be into the bloodstream, or toxins or viruses and things of that nature, the immune system becomes even more hyperactive, and then all of a sudden the foods that you were never sensitive to, you're sensitive to everything. And so this is why oftentimes when we do a food sensitivity test and we see that they're pretty much allergic to 3/4 of what we've tested, we know right away there's a leaky gut situation. And of course, since your neurotransmitters are manufactured in your gut, 30% of patients have depression and anxiety. And so again, we're really treating it with so many different layers. And Heidi, you're a gut specialist, so of course it's the first person that I want to send my patients to is get some analysis, get some testing, and then really start to heal the gut. Because honestly, you're not going to heal eczema unless you heal the gut at 100%, hands down. And then of course, we're not going to heal the gut unless we start to address the emotional component. I was telling Heidi this morning that I was doing some research on the emotional aspect of autoimmune or eczema in particular, and I came across a story of a doctor who was treating a 2-year-old little boy, and the mother brought the child, and she said, well, from birth this child had eczema pretty much from head to toe. So this child's been in angst and anxiety and pain, and of course it's been a very difficult child, because obviously if you cannot comfort a child, your loved one, then of course you're going to be in heightened stress as the mother all the time. And so they had been giving this child steroids, and the poor child was having one issue after another because the immune system was not able to cope and to fight secondary infections of the child scratching and itching. We as adults, we can just go, okay, don't itch, but kids, they just can't help themselves, right? Yeah. And so as he continued in conversation with the mother, after a few visits, he started talking to her about her emotional environment. And he said that the child was screaming and crying because was in pain and so forth. And that as they started talking about her story, the child fell completely asleep. And what was the story? The story was that when this woman had gotten pregnant, she was out of wedlock and really wasn't interested in marrying her boyfriend. So it was quite a turbulent situation, and she was planning on terminating the pregnancy, broke up with her boyfriend, but decided to go ahead and keep the child. But during her whole pregnancy, she was in conflict with herself. Do I want this baby? I don't want this baby. I'm angry, this and that. Why put myself in a situation? I'm not financially stable. So I always say happy mama, happy baby, because just as much as we get our nourishment through the umbilical cord, we also get her toxins, but we also get the emotional aspect of the parent as well that can actually start to affect the development of the brain of the child, and even that mindset of anxious attachment. And so as she was saying this, she said, of course, when my baby was born, I had no doubt that I wanted to keep this child, but this child has been developing with the mindset that I'm not wanted. And so again, we kind of look at that, and when she was speaking this and the child fell asleep, he started making some correlations, is that there's conflict here in the home, and we need to work on the parents, the mother, as well as the child, in order to heal this child. And so the story went on, but the bottom line is that when they started working in the conflict of the home, recognizing the child had issues with abandonment and not being wanted, and really started working on an emotional level, along with nutraceuticals. Obviously, they had to fix the child's gut, and along with other treatments that they did, the laser treatments and things of that nature, the child started having a lot of benefit and recovering from such an irritating, very hard type of a condition, especially for a child when they don't understand. So emotions are huge. So I really try to work with my patients. We have a practitioner here, Virginia Dixon, who does recall healing, and that's what this doctor did. Worked on what we call cellular memories of emotional trauma. And so again, it's so many layers, isn't it, Heidi, what we look at? But that's the beautiful thing about it, is we're really looking outside the box to treat the whole human rather than just the condition.
And bouncing off that, there's actually also some incredible research on the emotional constitution of someone with an autoimmune condition. And a lot of times these patients have a very self-critical perspective of themselves. They're hard on themselves. They don't give themselves a lot of grace. They're perfectionists, and they tend to manifest that even emotional component, and that's an emotional stressor that someone might be carrying with them that could be a belief system that's built on lies, that I'm not worthy, or I'm not, nobody wants me, or I'm not good enough, or whatever that belief system is. And that's an emotional constitution that we want to get to the root of as well, because once we become aware of those things, we can help to shift our perspective, and that just calms an entire emotional state down, which will impact your nervous system, which will impact how your gut can heal, how your immune system can heal,
how you respond to the outside world. Yeah, absolutely.
And then in terms of treating physically, we talked a little bit about addressing those underlying causes from a physical standpoint, an emotional standpoint, a nutritional standpoint. We want to get these patients off those offending foods, whether they're allergens, they're just foods they're sensitive to. Many times gluten and dairy are the biggest inflammatory contributors to autoimmunity, and so we want to do an elimination diet and start getting those things out of the body, and replacing them with nutrient-dense foods, because your cells need the nourishment to be able to cellular turnover in terms of creating a new skin layer that's moist, that creates a new barrier that's intact. Also, another huge treatment that we use here is oxygen therapy. And so we want to treat those lesions that are scaling and peeling and bleeding and oozing. We want to get rid of those plaques and those old dead cells, and then we want to create a new cell layer that's intact. And so that requires oxygen. So we want to improve circulation. We want to improve, like you mentioned, lymph drainage. There's some treatment options here that are very unique that will oxygenate the body. One of those is called a Nano Bath. It's literally a bathtub that you lay in, a warm bathtub that's filled with nanoparticles of oxygen. So we're getting oxygen-rich oxygen into the cells to be able to improve the oxygen uptake and start to heal those lesions and create new healthy cells. Other treatment options are lasers, like you mentioned that this child did. Laser treatment is amazing for skin conditions, not only wounds and that type of thing, but also eczema, psoriasis, any kind of autoimmune condition of the skin. And that's because there's various different types of light, and that could be red light, could be infrared light, could be ultraviolet light, could be blue light, but all of these lights have different therapeutic benefits. Not only can they kill off infection, they can also improve oxygenation and circulation to get nutrients to the skin, and also help to detox and get rid of those old dead skin cells that need to be removed. And so then there's also some IV therapies too that are very, very unique. One is IV laser, which actually delivers laser lights, those lights I just mentioned, into the bloodstream. And you get a systemic effect of these lasers. And then another is ozone therapy. Ozone therapy is an incredible form of oxygenation, incredible for regulating the immune system, calming down inflammation, supporting detox pathways. And so we do various forms of ozone therapy here. IV ozone is a big dose of ozone to the body. And then there can be smaller doses of ozone given actually as an intramuscular injection mixed with your own blood. And that has a longer effect in terms of a slower uptake, but has been incredibly beneficial for autoimmune conditions in general, especially skin-related autoimmune conditions.
I want to talk a little bit about the foods. And so again, as a nutritionist, I examined their diet. And as Heidi said, some of the most offensive things like soy and corn and gluten, dairy, nuts. So we want to eliminate these things. And then what we do is, because then we say, okay, great, skin started to heal up. Which one was it, right?
Right.
And so then a patient, we can do what we call rotation. And then, after a period of time, when we've arrested the situation, is reintroduce things and see how their response is one at a time. And so again, that would be kind of the least expensive route in regards of looking at potential food sensitivities without having a test. So that's very, very simple. Mm-hmm. Unfortunately, there's so many chemicals in our grains that most people are responding with an inflammatory response because of the glyphosates. And so this is why most often that I'm an advocate of grain-free diet, and also, replacing those with nut grains, coconut, almond flour, or even garbanzo flour or lupin flour. So again, if we have a nut issue, we can go to things like lupin, which is wonderful because it's a super high fiber and really super high protein, like a soy. But so often soy is an issue for patients with autoimmune disorder. So looking at the diet is really important. And then again, when we do have these allergy testing that we can identify which foods, we can actually, we have a person here, wonderful, her name is Mitzi, and what she does is she creates an antigen. And so of all the things that you're allergic to, she creates an antigen that you take as a shot yourself every 3 days to arrest the body in regards of wanting to attack. Now, I always find this very helpful when we are trying to treat leaky gut, is to get the immune system to stop fighting so we have a chance to treat. So I find that those antigen shots work really well, especially for, I would say, the first 6 to 9 months, really well, just to calm the body down so that we really can fix the leaky gut. And then, of course, we're always going to be looking at the adrenal glands too, because stress is a big factor, and the adrenal glands are the flight and fight response. So we kind of want a couple things in regards to what we know supports the nervous system, the peripheral nervous system, and really look at it again as how we can best create a lifestyle for the patient in regards to how they will live for the rest of their life, and in regards to the flexibility of the things that they can eat. But oftentimes they're very surprised after a period of time of really fixing their gut. They're able to eat so much more, and they can get back into a much more flexible diet once we've stabilized and really worked on to the leaky gut.
Exactly. And I have patients who come back and say, I had no idea how much my diet contributed to my inflammation, my energy, my gut symptoms. I mean, once I wiped out and did that elimination diet, I wiped out those offending foods. That may be hard for some people, but once you get over that initial deprivation stage and you start to feel better, you have a new awareness of, oh my goodness, I couldn't believe that those foods that I ate my whole life were maybe part of the problem, and getting rid of them and resetting everything doesn't mean they're gone forever. It just means we need to fix the underlying issue with the gut. but it's such a huge impact for people. And that simple thing, what you put in your mouth every day, may be part of the solution.
Right.
Maybe part of the problem, maybe part of the solution. And so that's why it's such a huge component of everything we do. And I hope that this video gave you a little bit more insight into what eczema, what psoriasis is on a cellular level, and then what we're doing from a testing standpoint to try to look for those underlying causes, and then how we can use integrative treatments from various different types to be able to treat these conditions and give you solutions that are sustainable and aren't full of horrendous side effects, and also are solving the underlying problem. So please ask any questions that you may have, any specific questions, anything you want elaboration on that we can help clarify and answer for you. And then please tune in next week for our next video.